Hello and welcome to today's program. I am Ogechukwu Ukegwe. The Nigerian Cancer Society, NCS, has said it is planning to launch a 10 billion naira cancer health fund to be driven by the private sector to serve as an alternative source of funding for cancer treatment and management in the country. The body also appealed to the Nigerian government to increase the amount allocated to Cancer Health Fund to help address the health menace. It says that NCS expected the government to vote at least 1 billion naira for the Cancer Health Fund for this fiscal year. Speaking at the seminar, the Nigerian Cancer Society, in conjunction with Badfanda, President of NCS, Abidemi Omunisi, said the organization is working on an initiative to mobilize funds from individuals and private sector entities to the tune of 10 billion naira to support cancer management intervention in the country. And the Coordinating Minister of Health and Social Welfare, Ali Pate, says 3 major cancer facilities with equipment investment will be commissioned by May 2025. Pate made this known to newsmen. He noted that the government also flagged off 10 other major center diagnostic centers across the country 5 months ago. The minister stated that the 201 tertiary facilities have had infrastructural upgrades and equipment in the last year. The Nigerian Cancer Society has rejected the 150 million naira earmarked for cancer care in the 2025 budget, insisting the amount will not be enough, considering the series of the disease and the cost of treating patients. The society appealed to the National Assembly to utilize the opportunity of the current budget review to possibly increase the amount allocated to the Cancer Health Fund. The president of the NCS, Abidemi Omunisi, raised the concerns during the workshop for the health journalists on human papillomavirus HPV vaccine uptake in Nigeria.
To stabilize some patient, you need average of 20 million. If a patient has breast cancer, you diagnose, you treat. To stabilize that patient, to give a little hope that that patient will survive, that patient will have minimum of 20 million. And now Nigeria is budgeting 150 million only to support prostate, to support cervical, and to support, cervical and breast. That is even nothing. It's better for the federal government to say this year we're not even supporting cancer patients. And we know that they are not willing to support. We must, do everything possible within their power to increase, that amount being, allocated to Cancer Health Fund. Otherwise, you are telling a cancer survivor to go and die, this year. How many patients can afford 20 million in Nigeria? How many? 20 million. We are so passionate, about this because a past president of the Nigerian Cancer Society, he was a professor. He sold his car, sold his house. We contributed money to save his life and died 2 years ago of liver cancer.
The support of the media is really very key to address myths and misconceptions about the human papillomavirus vaccine across the society. We've had few incidences of misconception, myths, and lack of understanding as regards the vaccine.
HPV vaccine is already routinized now into the immunization, routine immunization schedule for Nigeria, only that we still have issues regarding vaccine availability.
We'll go on a short break and the program will return shortly. Welcome back. Amid global concerns over the outbreak of the human metapneumovirus in China and other countries, Nigeria's Center for Disease Control has confirmed the country is at moderate risk following a dynamic assessment in partnership with the Federal Ministry of Health and partners such as the World Health Organization, the U.S. Center for Disease Control and Prevention, and the UK Health Security Agency. In a public health advisory, the agency said the federal government is closely monitoring the outbreak of the virus and is taking safety measures to strengthen the country's readiness and response capacity. The NCDC also assured it is also collaborating with port health authorities to ensure robust readiness at all international points of entry. The center says that while quarantine facilities are being identified and prepared to manage any suspected or confirmed cases if required, infection prevention and control materials are being deployed to point of entries to ensure adherence to hygiene and safety protocol. While joining me to discuss further is Dr. Baron Bless, a general practitioner at Ferroproid Medical Center, Abuja. Thank you for joining us on the program. So what exactly would you say is the human metapneumovirus and how does it affect humans?
Hello, good afternoon. Thank you for having me today. It's a privilege to speak on this. So basically, the human metapneumovirus, it's not a novel virus. Novel means a new kind of a virus. So it is not a novel virus or a new kind of virus. So it has been around since 2001. In fact, it was first isolated in the Netherlands by scientist Benedict van der Goor and a team whilst examining the 28-year-old having some respiratory symptoms. So it is not a new virus, it's been around. It's possibly been around like 50 years before. So why we are having it now, in increased rate is because post-pandemic, we have more sophisticated systems that help us, diagnose a lot of respiratory and other viruses. So because we have these systems in place, so we're just getting more diagnosis or more numbers of it because we are now having more sophisticated systems. So basically, the human metapneumovirus is a respiratory virus. This simply means it affects the respiratory system. It can be an upper respiratory virus or lower respiratory virus. That means when it causes more severe infection. It is not a severe infection that should cause, panic. It just has a flu-like symptoms like the normal flu, influenza, para-influenza, adenovirus. So basically, how it affects humans is it has a close sister called the avian metapneumovirus, which affects birds. So the virus was previously affecting birds before it jumped to start affecting humans. So it affects humans by, aerosols and contact when someone comes in contact with the infected fluids from an infected host, as the case may be, as a human. So the metapneumovirus hominis, which is the human metapneumovirus, will affect a host, a human, and elicits flu-like symptoms. Flu-like symptoms, right? Flu-like symptoms like cold, sneezing, flu, nasal congestions, but also, as much as it is not a severe infection, it can also cause lower respiratory tract infection. That means when the virus moves downward to the lungs, causing pneumonia and other kind of severity. So basically, the person comes down with those symptoms, flu-like symptoms, and it's people at risk. It's not usually causing a very severe infection. So the people at risk are, very young. So the two extremes, very young children, and also very old patients, and people with immunocompromised situations like the HIV or very old patients that have chronic illnesses before. So basically, that's what the human metapneumovirus is about. Thank you.
Okay. So how concerning is the news that Nigeria is considered to be at a moderate risk from the virus, especially given the global attention it is receiving? And also the NCDC has issued this assessment, but how serious should we take this virus?
Like I said before, it is not of a serious concern, although it's of concern, but not of a serious concern that should elicit panic. It should not elicit panic. Why? We have to know in Nigeria, we have what is called the National Influenza Sentinel Surveillance System. The National Influenza Sentinel Surveillance System. And it's a system that is available in all 6 geopolitical zones in Nigeria. It's available in all 6 geopolitical zones in Nigeria. It monitors, is the system that is responsible for monitoring of influenza-like illness, that is the ILI. Influenza-like illnesses, it helps to monitor these kind of illnesses. And also, we also have things like other severe acute respiratory infections. Now, these systems have been activated since the COVID era. So we have these systems with data available that we have analyzed. The Nigeria Center for Disease Control, collaborating with World Health Organization and other stakeholders, analyzing the data from these systems, which puts the risk at that moderate risk. So it is not of a severe concern that people should start to panic, as the case may be. So that is why it is kept at what we call a moderate risk right now in Nigeria.
Okay. So the categories of people said to be prone to this virus are infants, the elderly, and those with weakened immune system, just as it was during the COVID-19 outbreak. Is it likely that the persons who received the vaccine at that time are immune to this virus?
Yes, it is people at more risk of getting infected are the very young people and old people, and also people with immunocompromised states, like people that are chronically sick with HIV, AIDS, and all that. However, the people that have received the COVID-19 vaccines are not likely to be immune to the human metapneumovirus. To be more factual about it is that a vaccine, as the case may be, does not necessarily prevent somebody from getting infected, but rather a vaccine prevents the person from getting severely sick when infected with that virus or whatever disease that it was vaccinated against. So we cannot say the vaccine for polio can give people immunity against the COVID. It does not work that way. Okay. So there is nobody that will be having some form of immunity from receiving the COVID-19 vaccines or other vaccines. But just to be clear, as the case is right now, the human metapneumovirus does not have any vaccines available for it.
Okay. So how is this virus similar to or different from other respiratory viruses such as the influenza or the COVID-19?
So basically, like I said earlier, it is a respiratory infection. So it's when you hear the word pneumo, right? It's a respiratory infection, could be upper respiratory. Although that means it comes with same symptoms other viruses that affect the respiratory tract we come with. Like I said, fever, cold, nasal congestions, some body ache, and all that is going to start with that. So how does it differ from COVID-19 and other respiratory viruses? Because of the severity of the infection and testing. So if we take the fluid from affected or somebody presenting with the symptoms and we test it, we do what is called a PCR test, a polymerase chain reaction test that identify the genetic material of the virus. So when we identify it and the symptom the patient is presenting with, how severe it is, we manage accordingly. So basically that is the difference, is in the testing. We test to know which virus the person is being affected with at a particular time.
Given that Nigeria is at a moderate risk level, what measures should the public take to protect themselves from the virus, even though you mentioned that it's not something we should be worried about?
Yes, that is a very important question, because we said same thing during the COVID era. Oh, don't worry, we are in Africa, we are far. Although during the COVID era, I was in Europe, I was in the center of the heat, having some contact tracing. It was a terrible experience. Although in Africa, we are like, oh, we are in Africa, it won't affect us. The same situation we're having right now. So what will the public do to protect themselves? Basic hand or hygiene etiquette, basic hygiene. Like we did in the COVID era, the simple rule of 20-second rule of washing your hands with soap and water. When you go out, you come in, or you are in a place where someone is coughing, or that simple rules of hygiene, washing your hands very well, washing the things you eat, cleaning surfaces. Those are the simple things that people can do to prevent themselves from getting severely infected or infected by this human metapneumovirus. And also, they use the proper use. Imagine I said the proper use of personal protective equipment like the mask, wearing a face mask, carrying alongside your hand sanitizers, alcohol-based hand sanitizers, and all that is going to help in a long way to protect everyone in the community from getting infected.
Given the global concern, what are the key factors that contributed to this outbreak in China and other countries?
So, seeing what are the key factors that makes this infection so severe, or I would like to, in these countries, the major factor there is the climate. Okay. These regions, China, most of Europe, they are in what we call the temperate climate. Unlike Africa or Nigeria, that is more of a tropical climate. So temperate simply means people that experience seasons like winter, spring. The human metapneumovirus and other flu-like viruses like the influenza, parainfluenza, adenovirus, they move with the winter and the spring seasons. So imagine China right now in Europe and in Asia is winter. So definitely that is the major factor that could cause increase in the infection rate right now, because it is the season for flu-like illnesses right now. So that is the major factors that is influencing it as compared to Africa and the rest of the world.
What measures should the Nigerian government and health organization implement to contain the spread of this virus on an international scale?
So, to contain the spread of this virus in Nigeria and what do you call it, international scale,
yes,
is working close hand in hand with people that has the knowledge, the right knowledge to deal with these things. Qualified people to deal with these things. So we have things like border control, point of entries in border control, where we make sure that people obey the simple cleaning instructions on how to take care of themselves and hygiene in point of entry. All the borders, be it from the air, from the land, from the sea, whatever it is, these points of entries into countries should engage proper hygiene and personal protective equipment that should be sent to these points to prevent the spread of this infection whilst minimizing the cause of panic.
What role do travel bans or restriction play in preventing the spread of this new virus? And are there any effectiveness in this current situation?
Oh, I see. So imagine right now we are discussing about how people should not panic, and we are talking about travel bans. I think travel bans right now is just a bit over the board reaction. It will cause people to panic. Imagine the federal government declares that, oh, nobody is traveling, all international flights are cancelled. It will make people panic. So I think that is just an exaggerated response to it. However, just like we did in the COVID era, if we get to a severe situation, which I pray we will not get to, it's we have to implement these things to help the spread of the virus. So it's going to go a long way, but for now, I think that as a measure is an overreaction to the situation. It will cause a panic.
How will Nigeria's public health system continue to adapt if the virus begins to spread more widely?
So how will the Nigerian system continue to adapt if this virus keeps spreading? Basically, prepared, like the level of preparation, the federal government, the Ministry of Health, the Nigeria Center for Disease Control, collaborating with other stakeholders like the World Health Organization and NGOs, will help mitigate the spread of it. So like I said earlier, Nigeria has the National Influenza Sentinel Surveillance System, which is in the 6 geopolitical zones across the nation. So the early activation and making sure that these sectors and these establishments are functional, we go a long way in managing the whole situation in a case whereby we need to take those high precautions.
What long-term measures can be implemented to prevent future outbreak of similar viruses in Nigeria and globally?
Oh, I would say for that, two basic words:
Okay.
education and indoctrination. So proper education of the community from the grassroots, we cause what we call indoctrination. That is education, educating the public and the communities, indoctrinate them, and we create a culture of hygiene. You realize that post the pandemic period, lot of people no longer obey the simple coughing rules that you have to, cough at your elbow bend, or the simple instruction of washing your hands very well. Most people right now don't even move out of the house with their hand sanitizer and all that. So we are now relaxed, and when we are relaxed, that is when we get unexpected issues like this. So the proper education and indoctrination of the public, the society, through outreaches and the government making this thing known everybody on proper hygiene during the rise of these influenza-like or viruses that affect respiratory tract and other related illnesses is going to go a long way in preventing future cases and future occurrences of epidemics, as the case is right now, or pandemic as a whole. Thank you.
Thank you. Well, General Practitioner Dr. Baron Bless, thank you for lending your thoughts on the program.
Thank you so much. It's my privilege to be, it's a great privilege to be here. Thank you for your time, and I appreciate everyone and the team. There's no need for panic.
Thank you. And that's all for today's episode. Thank you for watching. See you next time.